In the case of dental fillings, there's various types of fillings available that can be customized to meet your individual requirements and tastes. In this short video, we'll look at the various types of fillings for dental use, their advantages and disadvantages, and what might be your best option. 1. Amalgam fillings. Amalgam fillings, also referred to as silver fillings, are employed in dentistry for more than 100 years. They're made from an amalgamation of different metals comprising silver, tin, mercury, and copper. The amalgam fillings are durable, robust, long-lasting, and affordable, which makes an excellent option for teeth with backs which are subject to a great deal of pressure from chewing. But there are some who are worried about the mercury content of amalgam fillings and would prefer aesthetic alternatives. 2. Composite fillings. Composite fillings consist from a tooth-colored resin which is bonded directly with the teeth. They are more visually appealing than amalgam fillings as they are matched with the shade of natural tooth. They are also flexible and are able to be utilized both on the front teeth as well as back teeth. They are, however, less durable than amalgam fillings, and they may have replacement more frequently. 3. Ceramic fillings. Ceramic fillings, referred to as porcelain fillings, are constructed from a tough ceramic material which is stain-resistant and biocompatible. The fillings are made by a dental laboratory to be matched with the color of natural teeth. The ceramic fillings are an extremely popular option for front teeth as well as those with sensitivities to metal. They are, however, more costly than composite fillings and could need more than one appointment to put. 4. Gold fillings. Fillings made of gold are an alloy of gold that is extremely robust and durable. They're biocompatible and will not break down like other kinds of fillings. Fillings made of gold are often thought to be the most suitable option for teeth with high pressure from chewing. But they're the costliest option and are not recommended due to aesthetic reasons. 5. Glass ionomer fillings. The fillings made of glass ionomer are tooth-colored and are a source of fluoride that helps in preventing tooth decay. They are typically utilized in the teeth of children as well as for cavities that are below the gum line. Ionomer fillings made of glass aren't as durable or strong like other fillings, and they may have to be replaced more frequently. 6. Resin ionomer fillings. Resin ionomer fillings have a similar appearance to the glass ionomer fillings, but are more robust and durable. They're often utilized in smaller cavities or for an interim filling. The resin ionomer fillings release fluoride as time passes and can protect teeth from decay. But they might not be suited for large cavities or teeth subject to lots of pressure from chewing. There are a variety of different kinds of fillings for your teeth, every one with its distinct pros, and the most appropriate kind of filling you need depends on your personal requirements and preferences, and also the place and the size of your cavity. It's important to talk about the choices with your dentist in order to decide on the most effective treatment plan to maintain your dental overall health.